So, Anne, what can you tell us about the comorbidity study?
There was a national comorbidity study, and so I'll give you a little question, Melinda. Is this true or false, do you think? 1 in 10 people in America have a diagnosable anxiety disorder. You think that's true or false?
My my first instinct would say that that's probably true.
Right. I would think most people would think, well, that makes sense. It's actually 1 in 4.
Oh my gosh, you're
So,
kidding.
yes, it's a very, very common disorder and very under-recognized and undertreated.
Oh my. Well, what would predispose somebody to an anxiety disorder?
There's a lot of things that can predispose someone. It can be genetics in part. If you have a family history of anxiety, you can be a little more likely to develop anxiety yourself in some form, environment, and exposure to early trauma. So all of those things can make one more likely to develop an anxiety disorder.
Wow.
Mm-hmm.
Can you explain, like, what's the pathophysiology of anxiety?
Sure, just briefly, as nursing students, you learn about the amygdala, the hypothalamus, hippocampus. Those are all part of what we call the emotional brain. The amygdala will sense a fear of some sort. The amygdala then will be in contact with the hypothalamus. And when that happens, and this happens in milliseconds, and it's automatic, you can't do anything about it. The hypothalamus then releases what we know as stress hormones, cortisol and adrenaline. What those things do in our bodies, we're all pretty aware of: racing heart, shallow respirations, all the blood rushing to the organs, so can be numbness in the hands and feet. And the hippocampus is also involved in that it stores anxiety memories. And so for someone who has something like PTSD, that's heavily involved as well. Just that's very basic, but those are the organs that are involved.
Wow, it's a lot more involved maybe than I probably thought originally.
There are some studies too that are pretty well regarded that show us that if you have been exposed to early trauma or abuse, that sort of early anxiety, that sympathetic fight or flight system that comes into place, that sets you up then for being more at risk when there's another stressor that comes down the pike later in your life.
Sort of like you're pre-wired for it, or?
Mm-hmm. Exactly. Pre-wired to respond more than, say, someone who did not have that early trauma.
Is there anything good about anxiety?
Well, sure. I mean, we all know that if there are, if we have a moderate level of anxiety, it can be a motivator, right? I mean, if you're taking this class and you're worried about doing well, being able to pay back your loan because you passed and you have a license, then you you can use that anxiety to your benefit. You study and you do well. But on the other hand, not enough anxiety, maybe you just won't be bothered. You won't try as hard. You might not even apply to nursing school, or too much. What we're talking about with anxiety can be paralyzing. And you can become indecisive and can lead to panic attacks and just immobility in general.
Wow. Mm-hmm. It's a pretty broad range of symptoms, I guess.
Yeah.
Yeah. So, what can you teach patients?
There are so many things that you can teach patients. as simple as learning to take 3 deep breaths, which you're going to learn in this course. Simple stretching techniques, like the yoga techniques, muscle relaxation, guided imagery, and also addressing thoughts, anxious thoughts, with cognitive behavioral therapy. And we'll talk about that in a little more depth in a future episode. So just that and more. There are many, many things. You can give people hope that anxiety is treatable and can be managed.
Great. Thank you.
Sure. You're welcome.